네, 안녕하세요. 네, 비온뒤 시청자 여러분 안녕하십니까? 안과의사 김명준입니다. 오늘은 제가 원래 방송하는 시간은 아닌데요. 특별한 손님을 모셨습니다. 테리 킴 선생님이신데요. 지금 듀크 대학에서 교수로 계시고, 물론 이제 뭐 세계적으로 유명한 안과의사시기도 하고, 그다음 미국 백내장 굴절 수술학회라고 ASRS라고 있는데 그 전임 회장님이세요. 그리고 한국계 선생님으로서 이제 부모님이 한국 분이시고, 그래서 한국에 대해서 관심도 많으시고 한국 선생님들을 안과 선생님들을 이제 국제적으로 성장하는데 많은 좀 도움을 주고 계시는 그런 분입니다. 그래서 오늘 이제 그 강의를 해주실 텐데 안과에서 내가 배운 것들 뭐 그런 제목으로 말씀을 해주실 건데요. 제가 뭐 짧게 이렇게 번역을 좀 해드릴 거고 선생님이 어떤 말씀 해주시는지 조금 기대가 많이 됩니다. Today we have a very special guest here in 비온뒤의 After the Rain studio, and he's a world-renowned ophthalmologist, a professor at Duke University of the United States, and the former the president of the American Society of Cataract and Refractive Surgery. And Professor Terry Kim이 is here, and thank you for joining us today.
네. 안녕하십니까. 반갑습니다. 저 김태리인데요. 미국에서 태어나서 저 한국말 잘 못해요. 그래서 영어로 해줄게요.
네네.
So thank you for the invitation. Pleasure to be on your program After the Rain, MJ.
Yeah, After the Rain has over 1 million subscribers,
Yeah.
and very popular the YouTube channel. So so your talk today is entitled Professional and Personal Lessons Learned from My Career in Ophthalmology.
Yes.
So what are you going to talk about today?
I had a chance to look at some of your previous episodes, so I was very impressed with the content. So I think you're going now on a little over 3 years with your program with over 1 million subscribers. So congratulations on your success. What I thought I'd do is the first half, maybe share with your audience some of the major areas of research interest and clinical interest in my career. And then the second half, I'd like to share with you my experiences with ophthalmology, specifically with regards to Korea and my Korean colleagues. It's been a very special and important part of my career. So I think hopefully this will be something that your audience will also treasure and value.
Okay. Thank you. And while your talk is going on, and can I just provide a short explanation to the audience in Korean language?
Sure, please. You are going to be much better than that.
Okay. 제가 짧게 이렇게 중요한 얘기들을 말씀을 드릴 텐데 그냥 한국말로 질문해 주셔도 되고요. 전반부는 이제 그 연구해 주셨던 것들 그런 거 여러 가지 연구들 많이 하셨으니까 교수로서 거기에 대한 말씀해 주실 거고 후반부는 이제 한국 선생님들하고 있었던 일들 관계에 대해서 말씀을 해 주실 거예요. 네. Okay, please.
So, I would like to start by talking about incisions in cataract surgery. Typically, now we're used to doing very small incisions for cataract surgery, but back in 1949, this incision was 12 millimeters long, so almost half the eye in order to take the cataract out. And Dr. Harold Ridley was one of the first to perform.
슬라이드가 혹시 보이시나요? 슬라이드를 좀 보여주셔야 돼요.
Right,
Okay,
so this is the picture showing the Von Graefe knife that's about to make a 12 millimeter incision. So now we're used to using small incisions in cataract surgery, and typically my incision size is about 2.2 millimeters.
예전에 아까 보여드렸던 사진은 한 12mm 정도 열었었는데 눈 길이 거의 대부분 한 반 정도로 열고 수술을 했었는데요. 지금은 이제 대부분 2.2mm로 수술을 하고 있다 뭐 그런 말씀을 해주셨어요.
So we now have the ability to use femtosecond laser for our cataract surgery incisions, which means the capsulotomy or capsulorhexis, and as well as the lens fragmentation, as well as the arcuate keratotomy for astigmatism and the incision itself.
네, 지금 이제 femtosecond 레이저라는 첨단 장비를 이용해서 백내장 수술을 하고 있다는 걸 이제 말씀해 주셨고 보여주고 계십니다. So you got a comment that wow, so handsome professor.
Oh, wow. I'm very flattered. Thank you. So this video is supposed to show the leaking of the incision. So even with small incisions, you can have leaking. And so this is a paper we published. This is a patient who also had a 2.2 millimeter incision. And the next day on the visit, I was surprised that this patient's eyelash, half of it was in the incision. So that made me think, wow, these incisions may not be as sealed as we think they are at the end of the surgery.
상처가 그 창상이 굉장히 작긴 하지만 2.2mm라고 그러셨는데 거기에 이제 새는 게 있었어요, 수술 다음에. 근데 보니까 속눈썹이 저렇게 들어가서 그 사이에 끼어 있으니까 저게 이렇게 다치지 않고 계속 좀 샜던 뭐 그런 경우를 말씀을 해주셨어요.
So if you think about the patient after cataract surgery, we ask them to put the shield on their eye, not to rub their eye, and they have to use the eye drops. But you may be surprised, this is some video showing you, these patients were just asked to demonstrate how they administer their eye drops. And I think it's very surprising. Here's the first patient.
Okay, go ahead.
이제 안약을 넣어보시라고 그랬더니 안약을 직접 넣으시는데 안약을 잘 사용을 못하고 계시는 거예요.
And obviously she's touching her eye. This is the second patient. It's almost like applanation tonometry.
예, 눈을 누르고 있는 증거이죠.
You gotta tip it. So it's vertical.
And then this
Oh,
last
got it.
one, I don't know how you translate to Korean, but this is almost a marinating technique.
예, 약간 이렇게 절이듯이 이렇게 양념 치듯이 요리할 때처럼 그렇게 해서 놓고 있는 상황이죠. 예.
So I share this because we know that incisions can open, and we know from this big endophthalmitis study, which is infection study, that most of these organisms are coming from gram-positive organisms, which are on the eyelid. So that's what we want to protect, is the infection of the eye and the leaking of the eye. So we have some recommendations on how to construct proper incisions, but even with the proper incision, you may have leakage. So typically we put the suture in the incisions. But now in ophthalmology, the trend is no suture. And most commonly, I know in this country, especially in US as well, we typically don't do any suturing with the cataract surgery. So there are some other alternatives. You may know you have super glue here in Korea, and this is super glue or Dermabond that we can put on the eye if they have some perforation or hole. But we know this glue is not made for the eye. It's off-label use, and it may be very uncomfortable and also cause complications, as you can see here.
그래서 수처를 하지 않는 대신에 저런 글루 같은 걸 쓸 수 있는데 보통 피부용으로 만들어져 있기 때문에 it's for the skin use. 그래서 눈에다 썼을 경우에는 여러 가지 좀 점들이 있을 수 있다. 뭐 그런 말씀을 해주신 겁니다.
So one of the biggest areas of research in my career was working with some chemists at Duke to try to find a new adhesive specifically for eye use or ophthalmic use. And this became also a side kind of innovative pharmaceutical business proposal and initiative, and it culminated in the FDA approval of the first ophthalmic sealant for cataract surgery.
그래서 이제 안과용으로 US FDA approved
Yes.
that one. Okay, congratulations.
Yeah.
그 허가를 받은 그런 이제 접착제가 되겠어요. 눈에 이제 상처를 닿는 그런 접착제를 보여주고 계십니다.
So it comes in a mixing tray. You have two kind of aliquots or two samples to use. It's basically polyethylene glycol. You mix it with the dropper and then apply it on the eye with the applicator. So you can see here I've mixed it, and then I'm putting it right on the eye. This is a patient that had conjunctival chemosis or swelling around the conjunctiva. In those cases, it's difficult to assess whether the incision is really sealed.
Right. 그래서 꿰매기 힘들 경우에도 저렇게 글루를 쓸 수 있다고 지금 말씀해 주시는 거고요.
Now, I also do corneal transplantation. And in those cases, the incision is larger, sometimes 4 millimeters. So you can see I put the diluent dropper on the dye, and then I'm mixing it for about 5 to 6 seconds. And then I apply it right onto the incision. And then the glue or adhesive or sealant polymerizes in about 11 to 12 seconds. And you don't have to take it off. It's very comfortable to the patient. Usually 2 or 3 days it's gone.
It doesn't cause any irritation?
No, very comfortable.
Okay. That's great.
So it was nice to have the experience of studying something in the research laboratory and then having it become clinically available. I know you're also involved in a lot of innovative research to make things better for our patients. So it was a good experience to have this available.
That's great. 이제 각막 이식할 때는 조금 상처가 큰데 그거를 이렇게 꿰매기 힘든 상황에서 저런 걸 쓰면 훨씬 쉽게 상처를 닫을 수 있다는 뭐 그런 말씀이시고, 이제 안과용으로 개발됐기 때문에 눈의 자극도 적고 굉장히 좀 좋은, 임상에서 쓰기 좋은 그런 거죠. 그래서 우리 임상적으로 하고 있는 거를 바꿀 수 있는 그런 연구를 해서 굉장히 좀 보람됐다, 뭐 그런 말씀을 해주셨습니다. 네. Okay.
So we've also done some publications on different areas regarding cataract surgery, for instance. One is when you do cataract surgery, even though we use phaco emulsification to remove the lens from the eye, sometimes there may be a little fragment that's left. And when I ask all my eye surgeons about whether they have a case of retained lens fragment, almost everybody has some experience with this. And this publication, for instance, we showed that we should not leave these segments and observe. If you really see a segment or fragment in the eye, we should remove it to prevent permanent corneal swelling and the need for a corneal transplant.
그래서 백내장 수술하고 렌즈 조각이 남을 수 있는 그런 경우에 대해서 좀 말씀해 주시겠어요?
And we also are looking at the importance of dry eye in our patients who are going under cataract or refractive surgery. Dry eye is becoming a very popular topic in our field because it's very common. Many cases are not diagnosed. And for a long time, we haven't had good diagnostic modalities to diagnose it. And we also had limited treatment options. But now that has gotten much better. In Korea, the dry eye incidence is very high. Most studies show in the elderly population as high as 30%. And then also even in younger patients. We used to just see dry eye. We used to think it was just peri-postmenopausal women. Now we're learning that dry eye can also occur in younger patients. So there was another study by Dr. Moon that showed that even elementary school children have dry eyes. And it's more common in urban settings or cities because of the use of digital devices like iPhone, iPad, computer, and many of these younger or gaming, many of these people are staring at the screen, which causes dry eye.
그래서 안구건조증이 굉장히 심각한 문제가 되고 있고 우리나라에서 거의 30% 그리고 굉장히 어린 뭐 초등학생들까지도 드라이아이를 안구건조증을 가지고 있기 때문에 뭐 그런 문제에 대해서 이제 연구를 하셨다는 뭐 그런 말씀을 해주시고 계십니다.
So we published this paper 3 years ago on evaluating dry eye in patients who are undergoing cataract and refractive surgery like LASIK. So we have some guidelines to help the clinician evaluate and diagnose these patients so we can treat them properly before surgery. And it's surprising, even though this is a surgical journal, this paper is the third most requested and cited paper in the journal because we think many of our doctors want a better understanding of these patients because many of these patients surprisingly are asymptomatic for their dry eye. They don't feel the discomfort or foreign body sensation, but they do have dry eye, which can affect their surgical outcome.
그 증상이 없더라도 안구건조증이 있는 분들이 있고 그런 경우에 수술 결과에 영향을 미칠 수 있다는 그런 말씀을 해주셨고요. 요거는 that is the official journal of ASCRS.
Correct. JSCRS. Journal of Cataract and Refractive Surgery. Yeah.
Cataract and Refractive Surgery. 예, 그래서 미국 백내장 굴절 수술학회 공식적인 그런 잡지인데 수술 관련된 내용은 아니지만 수술 전후에 안구건조증을 굉장히 잘 치료를 해야 된다는 뭐 그런 내용의 이제 리뷰 논문을 리뷰 아티클이 실린 거를 이제 말씀을 해주시고 계세요. 한 3년 전에 퍼블리시했다고 그러셨어요.
네, 맞아요.
네.
And then we also, in addition to dry eye, wanted to look at the impact of other conditions on the cornea, on the ocular surface. So these are all ocular surface conditions. Dry eye, anterior basement membrane dystrophy, Salzmann's nodular degeneration, all conditions that affect the cornea. And the cornea is the front part of the eye that has the most refractive power of the eye. Most people think it's the lens, but actually the cornea has 2/3 of the refractive power. So if you have some abnormality on your cornea, it can really affect your vision, and it can also affect the measurements that we're taking for cataract surgery. So this article that we published also in JCRS showed how we should identify these lesions and treat them, which is an outpatient procedure called superficial keratectomy. We just remove these lesions and then let the surface heal and then repeat the measurements for cataract surgery so that the patients will get much better calculation and much better visual outcome.
각막에 병이 있을 때는 그게 수술 결과에 영향을 미치기 때문에 수술 전후에 이제 계측을 하거든요. 이제 그런 거에 영향을 미치기 때문에 치료를 하고 좀 더 좋은 결과를 얻을 수 있다는 거죠. 전에 TY also was here.
Yes.
네, TY 정태영 교수님도 여기 있었는데 정태영 선생님도 he emphasized that the importance of the cornea in the cataract doing the cataract surgery. Yeah.
And Dr. Chung was one of my fellows, which we'll talk about later, and really enjoyed having him. So I'm glad something I taught him is keeping with him, and he's teaching this important point too. So maybe I succeeded in training him.
이렇게 질문들이 있는데 질문을 한두 가지만 받아볼게요. We're gonna take the one or two the questions, live questions, and Angel님이 질문 주셨는데 the patient was diagnosed with allergic conjunctivitis, and using the eye drops, including the steroid eye drops, and the patient has to use the eye drops too many times, and how can you advise the patient?
So that certainly is a good example. We also have, for example, many glaucoma patients who are on multiple topical medications, and many of these medications have topical preservative that can make the ocular surface worse. So I think that question is very relevant. When we have these patients, what we really try to do is, first of all, assess, is their ocular surface being affected by the drops? And if they are, we have to treat that. Sometimes that means temporary discontinuation of the drop. Usually that's not the case, but sometimes at least we try to restrict the amount of drops, maybe try to go to 1 time a day dosing if possible. For instance, with allergy, we also have the option of using some oral medication to control the allergy, at least until they can get to the surgery and heal and get good measurements, and then heal after surgery, and then go back to their typical regimen.
Okay. 그 안약 자체가 이제 여러 가지 눈 표면에 문제들을 일으키기 때문에 알러지도 그런 경우가 있을 수 있기 때문에 조금 먹는 약으로 이렇게 조금 바꿔서 치료를 해보시는 거를 권해드렸어요. 그리고 there are English the question.
So the question is, are there side effects after LASIK surgery in terms of night glare, and is that related to dry eye, and are there treatments for this? And the answer to that question is yes. We know that LASIK can cause and induce dry eye simply because of the creation of the LASIK flap. So the important thing, I think, is first of all, making sure that that patient is a good candidate for LASIK, because if there is evidence of dry eye, we really recommend doing PRK or surface ablation to avoid the flap creation, which really helps with the dry eye. But if you're in the position where you've already had LASIK and you're having some night vision problem and dry eye, yes, there is treatment. I highly recommend seeing an experienced, for instance, refractive surgeon who's used to dealing with this, and then usually there's a stepwise diagnostic workup to see the type of dry eye, the severity of the dry eye, and then coming up with a treatment regimen for you. The very important thing about this is the compliance, which means making sure you continue with the recommendations for the dry eye. Many times people feel just using the lubricating drop is not really medication, but we have actually approved medications. In fact, Korea just approved another recent anti-inflammatory agent. So there are options for this. And it's important that you get that consultation because there are definitely treatment options.
그래서 일단 정확하게 드라이아이에 대한 진단을 받으시고 거기에 대해서 꾸준히 치료를 하셔야 된다는 걸 강조를 해주셨어요. 네, 답변이 되셨길 바랍니다. 네.
Okay. So if you can show my screen again, I want to finish talking on the clinical side regarding corneal transplantation. It's interesting, depending on what country we go to, one of the problems is donor tissue is limited in terms of supply. In the United States, we don't have to worry about this, but also in terms of the technique, transplantation has evolved and gotten much better. So this is a patient of mine. This was a 79-year-old lady who had Fuchs corneal dystrophy, which just affects the back layer of the cornea. But we didn't have any other option but to do a full thickness transplant 20 years ago. So she had a successful transplant, but then she fell and she hit her eye on the table, and then her corneal transplant came off, and then of course her intraocular lens came out. Not ideal scenario.
지금 전에 이제 수술을 받았던 분인데 다쳐서 눈이 이렇게 좀 터졌다고 얘기를 하는데 그런 상황이 된 거죠. 그런데 이제 그때는 전층으로 이식을 했는데요. 이제 아마 그 부분층으로 이식하는 수술에 대해서 각막 이식이 발전해 온 거를 말씀해 주실 것 같습니다.
So now this shows you some OCT image of how our corneal transplant procedure has improved and evolved. We don't have to remove the entire cornea to treat posterior corneal pathology. And you can see the DLEC and then DSEC and DMEC procedure, and you can see the tissue is thinner and thinner with each procedure, which really improves our surgical technique in just replacing the tissue that we remove for these conditions.
그래서 그 이식편이 점점 이제 얇아지면서 기술이 좋아져서 이제 그렇게 하고 있다는 수술을 하고 있다는 말씀을 해주신 것 같아요. 네.
So this is the DSEC procedure. You can see the thin round tissue that's about 80 to 90 microns that we're implanting in the eye in this patient with Fuchs dystrophy with the insertion device, as you can see here. But now we've really moved to DMEC surgery. And we're very fortunate that the eye bank is able to prepare this tissue for us. So there's minimal processing by the surgeon. So you can see on the left is the very thin DMEC tissue that's supplied in the storage media, which has been carefully prepared by the eye bank. That's me. I take some forceps and I remove this carrier system from the media. And then you can see I'm going to take out the little tube that contains the donor tissue. And this tissue has already been pre-cut to 8 millimeters. It has already been stained with trypan blue. That's why it has the blue color. And it also has the S stamp, so we know which side is correct, right side up, right side down. And then I simply take this tissue that's in the Jones tube and I put it right onto my syringe, and now I'm ready to implant it in the eye.
그 이제 한 80, 90mm 마이크론 정도의 두께의 그런 이제 이식편을 썼었는데 지금은 그야말로 DMAC에서는 이게 각막 내피 이식이거든요. 근데 거의 멤브레인만 이식을 할 수 있는데 저렇게 컨테이너에 담겨서 오고 그 다음에 저렇게 아까 존스 튜브 is a glass tube.
Glass tube.
글라스 튜브 유리로 되어 있는 튜브를 이용해서 눈 안에다가 넣으면은 이제 이식이 끝나는 굉장히 간단해지고 거의 이제 각막을 예전 상태로 회복할 수 있도록 그렇게 기술이 발달하고 있다. 각막 이식 수술 기술이 발달하고 있다. 그런 말씀을 해주신 거예요.
So this is the implantation of the tissue here into the patient with Fuchs dystrophy. This patient, it's about a 3 millimeter incision. I release the tissue. And then you see I'm using a cannula to control the anterior chamber depth, holding that there so the tissue doesn't come out of the eye. And then there is a little learning curve to tap the transplant, not only in terms of opening the transplant, as you can see here, and then centering the transplant right where we need to. So that is an ideal insertion for this DMAC transplant. Now we have some alternatives that is even going to be better than this. And that is addressing the issue. There are many people who are waiting for corneal tissue worldwide. And about 60% of these patients have just posterior corneal problem, just the back layer. So now instead of implanting tissue, what we're trying to do is address the utilization of the donor to supply more than just one patient. Because now we take the donor tissue from the eye bank and that is only for that one patient. This revolutionary surgery, which is endothelial cell injection therapy, with one donor you can supply tissue for more than 300 patients.
Wow.
So if you look at corneal edema and endothelial transplants that we have, I showed you DSEC and DMEC, but you can see that endothelial cell therapy can cover the entire spectrum in terms of the mild, moderate, severe corneal edema. And this is a technique that was developed by my good friend and colleague Shigeru Kinoshita from Japan. And he came to Duke to lecture on this procedure. You take the donor cells and you grow it in the laboratory, and then you remove the diseased tissue from the patient, you inject the cells into the anterior chamber or the front part of the eye, and then the patient lies down, face down, for about 3 hours after the surgery.
이제 각막 내피를 이제 조직으로 이식을 했었는데 이제 세포만 이식할 수 있는 방법도 나와서 이제 거의 Is it commercialized already?
No, it's not commercialized, but I am working with this company. I'm on the board of Orion, which is probably one of the leading companies in terms of how advanced stage they are. We just finished our clinical trials outside the United States showing improvement of the corneal thickness and improvement of the vision when we inject these patients with the endothelial cell therapy.
아직 상용화되지는 않았는데 아마 지금 굉장히 임상시험도 하고 노력을 하고 계신 것 같고 그래서 이제 각막 내피에 문제가 있는 경우에 세포만 이식을 하는데 한 명 이제 여러 명한테 아까 300명까지 그렇게 이식을 할 수 있다 그랬으니까 그런 식으로 여러 사람들한테 각막 이식을 기다리고 있는 사람들한테 내피 이식을 좀 더 많이 좀 더 손쉽게 할 수 있는 그런 방법을 지금 개발하고 있다 뭐 그런 말씀을 해주셨습니다.
So we are excited to have the option of this type of therapy because the learning curve is much shorter and smaller. So we do go through a small incision to remove the diseased endothelium, as you can see here. And now all we do is take a needle and inject the cells through a separate incision. And it's very hard to see because the cells are so small. And then you're finished. And then you see the patients are lying down for 3 hours. And we are starting clinical trials in the United States in the next few months. And there are a number of companies who are trying to provide this type of therapy. So it'll be exciting to see the advance.
It seems like a game changer in
I think so.
endothelial transplantation.
Yes, I think it will be a huge advance. I think also it may be preventative therapy for patients who, let's say, we know they have some mild corneal problem or dystrophy, they have a thick cataract, and you know they're going to develop edema. So this may be an option to treat together with cataract surgery in the future.
굉장한 기술인 것 같은데 저희가 계속 관심을 가지고 이제 임상시험 성공하고 상용화가 돼서 저희 의사들이 쓸 수 있으면은 아마 전 세계 의사들한테 많이 도움이 될 거라고 생각을 하는 기술이고, so 여기에 involved 돼 있는 거죠.
Yes, I'm involved with the company. So it's exciting to be a part of some, innovation with a company. We're fortunate in ophthalmology to have many options. I know you have also been involved in many advances in terms of technology, so we can make the procedures better for our patients. So I think this is such an important part of what we do as ophthalmologists.
Wow.
So I'd like to transition to the more non-clinical portion of today's presentation. And by the way, I have to compliment you on your translation. It's so good.
Okay. I didn't translate everything, and it's just the key messages.
Yes, but I'm sure your audience appreciates that.
Okay.
So as we know, we are transitioning now to the post-COVID era, and a lot of our mask regimens have gotten more relaxed. This is a patient in my clinic. In the beginning of COVID, she complained that she had difficulty breathing with the mask, so she actually cut a hole in her mask. So I took my phone, just very quietly took a photo to demonstrate sometimes how people don't understand the importance at that time of wearing the mask. But the other portion I wanted to share were some personal lessons from my career. So in the center, this is my family, my wife and 2 daughters, and my mother and father and my mother-in-law. My father's in the middle, Terry Kim이. He was a graduate of Yonsei University and Yonsei Medical School. He was an OBGYN. And unfortunately, he passed of COVID in March of 2020, very suddenly. So the COVID epidemic definitely affected our family very significantly. But, I thought about this quote he would always tell me, you have your program named after the rain.
After the rain.
Yeah. And you explained the importance and the meaning of that term. My father used to always say to me, you never know which cloud will give you the rain. And I'm beginning to understand what he meant by that, meaning rain can be good, rain can be bad, and you never know what is going to be able to give you that good or bad element. And the reason why I use that quote today is I did not expect to be so involved with ophthalmology in Korea. So it has been a very, very rewarding experience for me. It started when I was at Emory as a resident, and I met some Korean fellows who were studying there from Yonsei. And I learned that I really enjoyed communicating with them and helping them. Many of them, first time to America, they could not speak English well, so my wife and I would help them, get adjusted to America and living there. And that really started the relationship between Korean ophthalmologists when I was a resident. And then when I became an attending at Duke Eye Center, I made the decision I would like to help educate some of the Korean ophthalmologists. So this is a list, partial list, but I think almost complete of the fellows that I've had an opportunity to train from Korea. And you may recognize some names, but I never expected that it would become an experience like this many fellows. And I will tell you that it is extremely rewarding for me to see how many of them have developed their careers and how positive their experience was. And also selfishly for me, when I visit Korea, It is so nice to see them. I always get invited back. I usually come back once or twice a year. And it's a great way for me to also maintain my relationship with my country. I'm very proud of what the Korean ophthalmologists have accomplished.
그 아버님께서 지금 연세의대에 나오신 산부인과 선생님이셨는데 이제 미국에 오셔서 이제 이제 의사로서 지내신 거죠. 그러면서 이제 테리킴 선생님 미국에서 태어나시고 계속 잘하셨고 이제 한국에서 오신 선생님들하고 계속 에모리에 계실 때부터 관계를 이렇게 계속 도와주시려고 노력을 하셨었고 듀크에 와서도 이제 많은 한국에서 오신 선생님들을 가르칠 기회가 있었고 그게 굉장히 보람되고 또 자랑스러운 일이라고 그렇게 지금 설명을 해주셨습니다.
So this has been the cloud that gave good rain, you know, as my father mentioned, because this has led to many opportunities, like social gatherings. This is my former fellow, Dr. Lee Dong-ho, on the left, and his wife, my mother, who likes to come to Korea with me. Many times I can bring her, which is a nice experience since my father passed. And then on the right is fairly recent. This is Dr. Chol Choi and Taeyong Chung eating some Korean fried chicken. And you can see, you think he's texting, but actually he's sleeping.
I'm not sure.
Yes, he's sleeping. I was there. I'm sure he was resting for the next day of clinic.
이동호 원장님이시고 일단 강북삼성병원의 최철영 선생님, 그다음 정태영 선생님 계신데 이게 지금 문자 보내고 있는 건지 졸고 있는 건지 모르겠다 그런데 그때 아마 술을 많이 마셔서 한국 치킨이랑 많이 먹어서 좀 이렇게 졸고 있는 것 같은 사진이라고 설명해 주셨네요. 네.
That's some soju there. Also, opportunity to meet at international meetings. This is my good friend Kim Won-kwon, which was actually the first Emory Fellow from Yonsei and his wife at Vienna for the ESCRS meeting. Also, even Korean meetings. So this was a joint KSCRS, ASCRS meeting, and your former chair, Dr. Hung-won Cha, was very generous to grant me an award during this meeting. But even internationally or even coming to Korea, the continuing collaboration, which is how we also started collaborating between our organizations. So it's not only started with, you know, our personal relationships, but became larger to enlarge and have our own respective organizations communicate and put meetings together.
아까 전에는 두 분 다 이제 은퇴하셨는데 아까는 연세대의 김은권 교수님이셨고 이제 올해 이제 2월달에 은퇴하신 아산병원의 차홍원 교수님이시고 이제 한국 학회에 와서 많은 선생님들과 교류하는 그런 기회에 대한 이제 사진들을 보여주셨습니다.
So this was at the APSRS meeting in 2022. This was my first meeting since COVID in terms of traveling internationally. It may be difficult to tell, but one session they had was called Squid Game, Challenging Cases. And you all are familiar with Squid Game, and it's been extremely popular in America. In fact, the Korean culture in America is very popular because of the Parasite and the Squid Game in terms of the movies and entertainment. Of course, K-pop, BTS and other groups, and also the food as well. So I think it's always fun to have some entertainment, if it's possible. And I was asked to lecture in this session called Squid Game. I didn't tell anybody this, but I was asked to give a topic, and so I just thought it would be fun to dress up in Squid Game. I didn't tell anybody this, so I think the audience was quite shocked when I showed up. And then they were applauding when I walked up to the stage to give this presentation. And I actually kept the mask and the suit during the entire presentation.
How did you get the suit?
You know,
Squid Game suit?
Amazon.
Amazon. Okay.
And it was actually very, very accurate. and
okay.
in terms of the color and the design. So
그 잠깐 설명을 드리면은 이제 안과 작년에 이제 코로나 거의 끝날 때쯤 아시아 태평양 백내장 굴절 수술학회가 서울에서 열렸거든요. 올해는 이제 싱가포르에서 열리고 아시아 지역에서 돌아가면서 열리는데 그때 이제 오셔가지고 당시 이제 유행했던 오징어 게임 컨셉으로 해서 강의도 진행이 되고 학회가 이렇게 좀 엔터테이닝하는 그런 요소들이 항상 조금씩 넣거든요. 예를 들어서 학회가 3일 4일이면 3일 4일 내내 계속 공부만 할 수는 없으니까 조금 이렇게 재밌는 요소들을 넣어서 이제 조금 더 물론 이제 거기에 뭐 여러 가지 배움도 있겠지만은 정보도 전달을 하지만 이렇게 좀 재밌는 것들을 많이 학회에 넣고 있습니다. 요즘 그런 걸 이제 설명을 해주셨고 이제 오징어 게임 분장을 하시고 아마존에서 구하셨다고 하셨는데 그걸 보여주셨어요. 네.
So, of course, golf is become very popular, and as I always enjoy playing golf in Korea, and I've had a chance to play with Hung-Won Cha and Young Do-yoon and many others here. You know, the Korean people are such good golfers. I'm always impressed. Not only on PGA level,
yeah.
but also non-PGA level.
Even the Korean amateur, the golfers are good.
Yeah.
I'm not a good golfer.
Well, actually, I'm glad you brought that up. You may not be a good golfer, but you may not know your audience. I'm going to educate them that your host here, Dr. MJ Kim, is a very talented person outside of ophthalmology too. Obviously, very well-respected ophthalmologist and surgeon, but he asked me to go bicycling with him. This was before, obviously, COVID, maybe 5 to 7 years ago.
Yeah.
And
2018 or something.
Yeah. Took me to Paotang, and boy, I think I did okay, but I was impressed of how good a cyclist he was.
Well, I don't know.
But we enjoyed it. I really enjoyed that experience.
Good sceneries and good
beautiful
atmosphere.
scenery.
Yeah.
And it's interesting, I'm learning as I come to Korea that there's a big trend in terms of improving the healthy lifestyle of the people, which is good. And of course, one of the exciting highlights for me was to come back to Korea for the Olympics. And I think Korea did such a wonderful job hosting the Olympic Games. World-class snow skiing ophthalmologist to my right, Dr. Kim here, and he actually provided medical services for the Olympic athletes during the Olympics. So it was great to know that you were able to provide that kind of a service to the athletes. I always wondered though, only just their eyes, or what happens?
No, I organized the medical services.
Okay.
In the field of play.
Yeah.
And the picture was taken during the test event before the main event of Pyeongchang Olympics. We did several hosted events to prepare the real Olympic Games.
That's great. Well, the preparation was excellent for the event. I really enjoyed it. One lesson I also want to share with the audience, especially the medical students, the residents, fellows who are doing ophthalmology or going into ophthalmology, or really any medical field, it's important to have balance between your work life and your personal life. Medicine is demanding. So, you know, again, which cloud is going to give you the rain? I did some DJing when I was in high school, just for fun. And then in 2010, I was asked to provide some entertainment for some social organizations in ophthalmology, and it has become really a big event. Usually 2,000 to 3,000 people attend our DJ events, which is usually at every AAO and ASCRS meeting. And I never anticipated that this would become so popular, but it's a nice way for me to diversify what I do at the meetings.
그 학회 때 이제 저녁 때 소셜 이벤트들이 있거든요. 그래서 서로 이제 네트워킹 할 수 있는, 뭐 낮에 이제 공부를 하고 서로 뭐 발표도 하고 여러 가지 뭐 교류를 하는데, 저녁 때는 조금 더 이제 개인적으로 친해질 수 있는 기회들이 생기는데, 테리 킴 쌤이 이렇게 디제잉을 잘 하세요. 그래서 이제 큰 이제 학회 때 저녁 때 소셜 이벤트 있을 때 디제잉을 하시면은 거기 가서 또 같이 즐기고 좋은 시간을, 기억에 남을 만한 그런 시간을 보내고 있는 그런 걸 이제 소개를 해주신 거예요.
So you can see your former chairman, Dr. Hong-Won Cha, also enjoying the DJ entertainment at the ASCRS.
저기 차흥원 선생님인데 저는 저렇게 즐거워하시는 거 처음 봤어요. 한 번도 본 일이 없어요. 그래서 정말로 재밌으셨구나 그렇게 느꼈습니다.
So the other lesson that I want to share is, I always enjoyed basketball growing up. I went to Duke University as a college student, and basketball was always very popular there. But when I became faculty, I had an interest in giving back to the school. And so I asked about the eye care for the team. And I was surprised there was no official ophthalmologist. They didn't have any formal eye screening program. So I proposed to the coaching staff, why don't we do this? So we've been doing their screenings for over 20 years. We have published some impressive findings about eye injuries that occur, eye diseases in these athletes. And also, this article was in the Wall Street Journal when we discovered, myopia, undiagnosed myopia in one of the star basketball players. So it's been a really, again, I didn't know that cloud was going to give me that rain in terms of now being able to provide the ophthalmology care for the basketball team. And this has led to close relationship with Coach K, who was our coach. He just stepped down, and now John Shire is our coach. By the way, his career ended because he had optic nerve head avulsion injury playing basketball. So he lost complete vision in his eye. And so that's why we formed the Duke Sports Vision Eye Institute based on that injury. So trying to help people who have suffered some incredible injuries. And I wanted to just remark, it's certainly been an honor to be part of ASCRS as former president. I can tell you that I've been impressed with the organization, but also its leaders. Many Korean Americans, Bonnie Henderson, former president, currently now Doug Rhee is our president, Korean. Next president will be Dr. Elizabeth Yu, Korean. And then 2 years after that will be Dr. Francis Ma, Korean. And this has just been a wonderful opportunity to show how Koreans have had an impact in American ophthalmology. Dr. MJ Kim serves as our international representative on the ASRS Corneal Committee. So it's been a real wonderful opportunity. 2020 was my presidential year, but unfortunately the meeting was canceled. And but I still had chance to spend time with Coach K. And again, just like meeting the opportunities of other ophthalmologists here, I had a chance to meet many people through the basketball connections, including Jason Tatum, who was with the Celtics, Zion Williamson, Magic Johnson, and really an opportunity also to thank the people who trained me, both at Emory and at Wills. And also all the fellows, not only my Korean fellows, but all the fellows that I've trained in the past 25 years. It's been a very rewarding experience. And of course, I want to acknowledge and thank my Korean colleagues here. I'm very proud of what they have accomplished in their field, and also thank them for their friendship. Many times I asked, in many ways, Korea is more advanced than America in terms of getting access to devices, and it's been a wonderful opportunity to interact in that way.
이제 ASCRS가 백내장 굴절 수술학회에서는 전 세계에서 가장 큰 학회거든요. 미국에 있는 학회인데 그때 이제 전임 회장님도 계셨고 뭐 여기도 지금 그 테리 킴 선생님도 전임 회장님 하셨는데 앞으로 이제 또 회장 하실 분들도 코리안 아메리칸들이 많은 거예요. 이제 한국의 선생님들이 많이 계셔서 굉장히 잘하고 계시고 또 한국 선생님들도 한국만의 장점이 있죠. 여러 가지 디바이스라든지 저희 IT 같은 데서 강점을 가지고 있고 뭐 그런 것들에 대해서 조금 더 이제 국제적으로도 많이 기여할 수 있는 기회가 있을 거고 많이 발달했고 이제 그런 말씀을 해주셨고요. 사실 뭐 이제 다 얘기했는데 I was looking at your clinical achievements, the research achievements. I was so excited to see that, and also the father's saying that the which clouds will give you the rain. 어떤 구름이 너한테 이제 비를 내릴지 모른다. 그러니까 그게 좋은 비일 수도 있고 나쁜 비일 수도 있지만 어떤 비를 내릴 수 있을지 모른다. 그래서 평소에 이렇게 주변에서 일어나는 일들에 관심도 가지시고 좋은 관계를 가지기 위해서 노력하는 게 굉장히 중요하다. 그런 말씀을 해주신 것 같아요. The father's the quote was so touching to me.
Yeah, and I think maybe some way it led to this participation in your program called After the Rain. So,
Right.
So what a wonderful opportunity. Congratulations to you, and hopefully my father's watching and smiling.
네. 한국에서 저 하늘에 계신 아버지께서 보시고서는 보시고서 기뻐하실 거라고 하시네요. 이제 시간이 다 돼서 또 이제 정리를 해야 될 것 같고요. 여기 이제 채널도 After the Rain이라서 비온뒤지 않습니까? 그래서 이제 레인에 대한 또 얘기랑 또 연결해서 굉장히 좋은 시간이었던 것 같습니다. Yeah, thank you again for joining us today.
Yeah.
And hopefully you can be here again for the next visit.
Well, that would be an honor. But thank you all for watching, and 안녕히 계십시오.
네, 고맙습니다.
고맙습니다.